Joining me now is New Jersey Governor Phil Murphy, whose state is averaging nearly 5,000 new COVID cases per day and will receive about 76,000 vaccine doses in this first distribution. Governor, thanks for joining us again. Good to see you. When will the first shots be administered, and how do you divide these first 76,000 doses between the healthcare workers and the nursing homes?
Martha, good to be with you. I'm happy to say that, and I'll be there Tuesday morning at University Hospital in Newark, New Jersey. We will begin vaccinating our heroic healthcare workers. And you're absolutely right, the first batch is 76,000, split the majority toward healthcare workers, but a good slug toward our long-term care residents and staff. And then with each ensuing week, those are the two top priorities. And it'll take us a number of weeks, as you can imagine, to work through the entire populations in both of those groups. But it's going to be a big day on Tuesday morning in Newark.
So after these initial doses are given to the healthcare workers, nursing homes, how are you prioritizing which group should get the next shots? Utah's governor, for example, announced school teachers would be in the first phase of vaccinations there. Do you know exactly who is next in your state?
Yeah, we're still working that through. I think every state is doing the same, working with the CDC, federal guidance. The so-called 1A bucket are healthcare workers in long-term care, and then 1B is a much larger group. Every one of them a worthy population of getting to early. We're working through that right now. Remember, Moderna is up for their emergency use authorization this week. And God willing, they get in. Then you've got not only increasing batches from Pfizer, you've then got a second vaccine coming online with shipments each week. And those larger populations will then be dealt with. I think of it as in overlapping waves. You know, we'll be doing, for instance, the second shot for healthcare workers, long-term care residents, as we're beginning first shots for the broader populations in that 1B group.
And one of the biggest concerns now is ensuring enough residents get the vaccine to control COVID spread. A survey from your health department in mid-October found that fewer than half of New Jersey's nurses would definitely or probably get vaccinated. What are you telling residents skeptical of taking the vaccine if even nurses won't get it?
Yeah, I think the number, please God, as it relates to nurses and healthcare workers has gone up meaningfully, because I think this confidence has been building around these two vaccines now pretty much as a drumbeat for weeks upon weeks. But listen, Martha, we've got to begin with a skeptical anti-vax bloc, which is a minority, but they're strong. And then you've got on top of that what some folks sense was the politics getting involved in the development of these vaccines. I would just say to folks, first of all, we're not waiting until we get them. We've already been pounding away that these are safe, they work, and that's a message I repeat right now. We have had our medical folks kick the tires up and down. We believe in these vaccines. They're safe, they work. We want people to get them.
And I want to turn now to the alarming number of COVID cases surging nationwide. This is a great hopeful day, but including in New Jersey, you've had a real surge, which averaged about 5,000 new cases per day this week, as we said. CDC Director Robert Redfield recently warned that for the next 60 to 90 days, we're going to have more deaths per day than we had at 9/11. What's the most important thing you're telling residents to do about this pandemic?
Yeah, Martha, for all the good news, the light at the end of the tunnel, and the vaccine exemplifies that as much as anything, the next number of weeks are going to be hell, I fear. So we're begging with people to please, please, please don't let your guard down, even when you're in private settings. You know, we think somewhere between 60 to 80% of our transmission is in private settings right now. Celebrate holidays small with your immediate family. We know that stinks, but please God, that's your down payment for a more normal one next year. Social distancing, face coverings, the basic stuff we cannot let up. And the next, I think, 6 to 8 weeks are going to be really challenging. But we'll get through it, but we got to not let our guard down in the meantime.
Do you worry at all that the vaccine coming might make people less inclined to follow these instructions?
I do. I take the other side of it, which is, hey, listen, we're going to be putting shots in the arm Tuesday morning in Newark. This is coming. And by the way, I think by April, May, everybody will have access to one of these vaccines. And so therefore, this is not forever and for always. It's a short sprint. So do the right thing. I do think the concern on the other side is real, Martha, where folks say, particularly younger folks, say, heck, I haven't gotten it so far. This vaccine's right around the corner. I'll take my chances. Please, God, go the first route and not the second.
And we are hoping the same thing, and that is for sure. Thanks very much for joining us, Governor.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.